Hello everyone, here is a quick summary on mood disorders and like bipolar and related disorders. So just follow through this video. It's just a quick summary guide about all these mood disorders. Okay, so we're going to define what a mood is, what affect is, what is unipolar, bipolar, and all that, and the criteria that we use to diagnose. All right, I have my reference here so that I don't leave anything behind or unspoken. All right, so for mood, it's a pervasive or sustained emotion that in extreme it markedly changes it markedly colors the person's perception of the world over a long period of time. All right, it's a pervasive and sustained. Example, you can it can be like within 2 weeks, 1 month, or something like that. So the affect, it's a pattern of observable behavior that it's the state of expression of a subjectively explained feeling or state, emotions, uh, and it's variable over time in response to the changing emotional states at that time. So here it's just the pattern of the observable behaviors and the expressions. All right, like how a person expresses their emotions and all that. So how do we classify mood disorders? We have unipolar, unipolar single episode, unipolar recurrent, and dysthymia. So we can also have bipolar 1, bipolar 2, cyclothymic. All these fall under bipolar disorders. So for bipolar disorders are also called bipolar affective disorders or manic or depressive disorders. All right, so one of the most common severe persistent characterized by periods of prolonged and profound low mood, that is depression, but it alternates with periods of excessively elevated or irritable mood, that is what we call a mania. So briefly, we are going to look at what a manic episode and hypomanic episode and a major depressive disorder. All right, so for a manic episode, it is a distinct period of abnormally and persistently elevated, expansive, or irritable mood lasting for at least 1 week or less if the patient must be hospitalized. All right, so hereby is where the person, like, it's a period of time whereby it's abnormal and persistent elevation of like the mood, elevated expansive mood within a period of like 1 week or less if the patient must be hospitalized. That is manic. Like the person is over irritable, over excited, over here, which is abnormal, not the normal one. All right. For hypomanic episode, it lasts at least 4 days, just the same as manic, but here it's the duration that changes. For a manic episode should be at least 1 week. For hypomanic, at least 4 days. All right, and it's just similar to manic episode. So for this one, it's not that severe to cause hospitalization. All right, and it's not even okay. Yeah, it's not even severe to cause impairment in the social or occupational functioning of a person. Okay, so for a major depressive disorder, it occurs without a history of manic, mixed, or hypomanic episode. So here we don't have, it's just the depressive disorder, the depressive episode. There are no manic, there is no hypomanic. So it lasts for at least 2 weeks and should be accompanied by other symptoms. You're going to check the symptoms of major depressive disorder or a manic or hypomanic, and all that we are going to check on them. All right, so for a bipolar disorder, it's a cyclical mood disorder whereby we have abnormally elevated mood or irritability that alternates with a depressive mood. Okay, so for bipolar 1, we have at least one manic episode or a mixed episode that is both manic and depressive. For bipolar 2, we have at least one major depressive episode and one hypomanic episode. So that's how we classify them. Bipolar 1, there should be at least one manic and or mixed, that is both manic and depressive. And for bipolar 2, we only need one major depressive episode and one hypomanic episode. Yeah. So for cyclothymia, so it's hypomania with a minor depression. Like it's not like it doesn't meet the criteria of the major one, like 2 weeks and all the symptoms that you are going to check after this. All right. So we also have another classification that is under the classification we have bipolar 1, bipolar 2, cyclothymia, medication induced bipolar disorder, bipolar unrelated disorder due to another general condition. Yeah, maybe other conditions that you are going to check. Yeah. So for epidemiology or the prevalence, bipolar 1 about 1%, life prevalence, bipolar 2 disorder 0.4 to 2%, cyclothymia 2 to 5%. All right. So for the mean age of onset is about 21 years of age. All right. So 90% of these disorders will develop before the age of 50 years. Okay. So it is most common in urban areas and common in high social classes or so high socioeconomic states. All right. So according to the sex or gender, the ratio between male to female is 1:1. So we just have equal number of people, that both female and males, that can get this bipolar disorder. So for bipolar 2 disorder, we have a bit a high prevalence in the female, and for marital status, it's lower in married than the divorced or the ones who have never married. Okay, so etiological, there's a strong genetic. They have to be like, mostly they can be genetic or they are genetic. So if there is any first degree relative or even a relative just in your family line, you are most likely to acquire these diseases. Example, even if you have the twins, the what do you call the twins? So if one twin has this disorder, there are high chances even the other twin will have these disorders. What are the other psychosocial factors that can predispose one to these bipolar disorders? We have life events and environmental factors. So one, we have the stress, which it commonly precedes the first episode of both the major and the manic. Example, we can have job loss. Some people cannot cope with such stress of losing a job and loss of a loved one, divorce, and all these strong emotional factors. All right. So another one, we have pregnancy. Most of the time it carries there's a risk, because some of the times there are these depressive disorders and all that. So pregnancy is also a risk factor for both the depressive and manic episode. All right. So another one is about the biological factors. Hereby we have the dopamine activity and all that. I won't go into much details about the etiology, or yeah. So in quick summary, my major interest was and the diagnosis. Hereby we are going to use DSM 5 to diagnose these bipolar disorders, bipolar and related disorders. So for bipolar 1 disorder, we have said, what have we said when we classify bipolar? Okay, can you recap? All right. So let us dig into this. So it is necessary to meet the criteria. So there's a DSM 5 criteria. At the moment you're using DSM 5. So we are going to refer from DSM 5. Then it has to meet the criteria for a manic episode or a major depressive episode. So we have said there's that we can have a mixed, that is has the manic episode and the major depressive episode. So for a manic episode, what are the criteria that should be met for you to diagnose someone with bipolar 1 disorder? We are going to check at the manic episode and the depressive episode. So for criteria A, a distinct period of abnormally and persistent elevated, expansive or irritable mood, and abnormally and persistently increased goal-directed activity or energy lasting at about 1 week, and it's present most of the day, nearly every day, or any duration if hospitalization is necessary. So for criteria 1, there is this distinct period, and we have said it should be lasting for at least 1 week, and they should be abnormally and persistently elevated, expansive or irritable mood, okay, in a period of around 1 week, or if it is less, if hospitalization is necessary. For criteria B, it says that during the period of mood disturbance and increased energy or activity, 3 or more of the following, all right, should be present. So 1, inflated self-esteem or grandiosity. Yeah, you know, the inflated self-esteem, you feel as if you are on top of this world, you feel like you are greater than everyone else. All right, so that is the first symptom. We have inflated self-esteem or grandiosity. 2, we have decreased need for sleep, like one feels rested even after 1 hour of sleep. You just don't need sleep. All right, this is manic episode. 3, the person is more talkative than usual, or there's that pressure to just keep talking. You just keep talking and talking. Yeah. So 4, we have flight of ideas or subjective experience, that thoughts are racing. You have too many thoughts that after this thought, the next thought, the next thought, like your mind isn't resting. They're just those racing thoughts. The 5th one, we have distractibility. That is, the attention of someone is easily drawn. Example, if I'm starting doing like a task, I cannot complete that one because I'm easily distracted. If I'm doing something, then just a distraction, then I switch off. All right. So another 6 is increased in goal directed activity, either socially, at work, or school, or sexually, or psychomotor. We just have increased activity. Someone who, okay, I'm not saying this is wrong, but example, someone has just been singing the whole day, 24 hours, and he's doing this repeatedly. Example, for a whole week, someone is just singing, and is not getting tired. All right, someone is just doing something like it's kama overdo, yeah, overdoing. Anyway, so the 7th one is excessive involvement in activities that have high potential for painful and consequences. Example, some businesses, those some investments. So example, just one, uh, sends money to someone, like they're in the name of investing, but this person is not okay. Like, this kind of people, they just send to a random person, or they just go buying everything, even the things that they don't need, something like that. So in these 7 symptoms, if the person has like 3 of these symptoms that I have listed 3 or more symptoms in this 1 week duration, this is probably a manic episode. But we are going to check on criteria C, D, and the other criteria, okay? We are just in criteria B. For criteria C, it says that the mood disturbance is sufficiently severe to cause marked impairment in social or occupational function, or to necessitate hospitalization so to prevent harm. So if this mood disturbance is sufficient enough to cause marked impairment in social or occupation function, when like these people are irritable and all this, like they cause havoc, they cause disasters in the homes, they cause like, you know, these people, they just cause trouble everywhere. So hospitalization will be necessary to just prevent or prevent major damage, because people, they can just be harming themselves, throwing up things, running up and down, involving in this risk behaviors, risk taking behaviors and all that. So for this patient, hospitalization will be necessary to just prevent further damage. For criteria D, it says that this episode is not attributable to the physiological effect of a substance, e.g., a drug of abuse, medication, or other treatment. So, where this episode or this person experiences this episode, there should be no psychological, like it should not be attributable to any physiological effect of any substance. This person should not be like abusing any substance, any stimulant, or any medication that can cause such symptoms. Okay, so we have an NB here. It says that a full manic episode that emerges during an antidepressant treatment. Example, yeah, that's an example. So we are going, yeah. So here we have said the manic episode, we have criteria A to D. In summary, criteria A, there should be this, a period of abnormally elevated, expansive, and irritable mood that runs for at least 1 week. For criteria B, during this period, they should have these 7 symptoms. I don't want to repeat them, but anyway, there is that grandiosity or high inflated self-esteem, decreased need for sleep, flight of ideas, more talkative, distractibility, increased goal-oriented activity, excessive involvement in activities that have potential for painful consequences. Criteria C, we have the mood disturbance is sufficiently to cause marked impairment in the social or occupational function. And D, this episode is not attributable to any substance or any medication. All right, so under the hypomanic episode, we have said a hypomanic, and then we are going to check at the major depressive episode. Okay, so for hypomanic, we have how many? We have 6 criteria. All right, for criteria A, just the same, a distinct period of abnormally persistently elevated, expansive or irritable mood. So but this one, the duration is going to change. For this one, we're going to have at least 4 days, okay, not 1 week as the manic episode. Then for criteria B, during this period we should also have 3 or more of the symptoms that I've already mentioned. I don't want to repeat again. All right, yeah, those symptoms, the manic symptoms that I've just mentioned. So 3 or more, it still will fall under the criteria. For C, for criteria C, this episode is associated with an unequivocal and change in functioning that is uncharacteristics of the individual when not in the symptomatic phase. All right, so and criteria D, the disturbance in the mood or change are also observable with others. If people just observe, hey, this person is not, hey, there's like the way this person has changed or is doing things this way and that way, yeah. So if people observe, it also fall under criteria D. For criteria E, the episode is not severe enough to cause hospitalization, or it's not severe enough to cause impairment like in social and occupational, as compared to the manic episode. We said it has to cause impairment in the social functioning of this person. All right, and for criteria F, this episode is not attributable to any physiological effect of any substance or medication. So that is a hypomanic. Have you noticed the differences here between the manic and the hypomanic? One is the duration. All right, duration for the manic is 1 week. This one is for around at least 4 days. For hypomanic, it doesn't cause that marked impairment in the social functioning of the person, but manic it does. And for manic episode, like electroconvulsive electroconvulsive therapy is necessary, but in hypomanic we don't require it. All right, so we are going to go on the major depressive episode. Yeah, I'll follow this, at least I don't divert. If you don't have a guide, you're easily distracted and you can easily divert. So for the major depressive episode, one, criteria A, we have 5 or more of the following symptoms have been present during this same week. So here, under the duration, we're going to have a 2-week duration and can represent a change from previous functioning. At least one of the symptoms is either 1, a depressed mood, 2, loss of interest or pleasure. So what is this depressed mood that we are talking about? So most of the day or nearly every day, as indicated by maybe the person or just people report, they feel sad, they feel empty, or they feel hopeless. This is just a depressive mood. All right, or observation made by others. They observe, they look at this person and the person is tearful, the person is always sad, the person is just, yeah, you know how a depressive person looks like. Yeah, so in children and maybe adolescent, it can be an irritable mood, not the normal depressive mood that I have talked about. All right, so that's, take note. For children and adolescents, we can have irritability. All right, so 2, the markedly diminished interest or pleasure in all activities most of the day, nearly every day, as indicated by either subjective account or observation. Yeah, markedly diminished interest or pleasure. Things maybe you loved doing, you no longer find pleasure. You loved watching series, movies, all that, playing football, but you do not gain pleasure in these things anymore. All right, so 3, we have significant weight loss when not dieting, or weight gain, e.g. change of more than 5% of the body weight in 1 month, or decrease or increase in appetite. So there is a decrease or increase of appetite, like just abnormal. Someone who didn't like eating now has increased appetite, or someone who had high appetite now he doesn't want to eat. All right, or we have significant weight loss, example, losing 5% of the weight in a period of 1 month. So you should be concerned if this person has this depressive mood and marked diminished interest on the things or activity that he loved doing. So 4, we have insomnia or hypersomnia nearly every day. So this person, they just lack sleep, they can't sleep. All right, so another one, we have psychomotor agitation or retardation nearly every day, observable by others, not merely subjective. Yeah, so most of this, something that we've noted, most of these symptoms, observation by others also can count as part of the symptoms of this patient. All right, so another one is fatigue or loss of energy. You are just tired every day and you have some of the symptoms that I have mentioned. For this, we've said for criteria A, you have to have 5 or more. Yeah, so and number 7, we have feelings of worthlessness or excessive or inappropriate guilt, which may be delusional. There's just guilt. You just feel like if you're unworthy, you feel that you're useless, you feel that all this, yeah, you look down upon yourself and all this. All right, for number 8, we have diminished ability to think or concentrate. Yeah, you can't concentrate, you're not attentive, you're just all over the place. Okay, not all over the place, but you just there's just, in class, people are busy concentrating in class, you can't concentrate. When you're doing your own things, you can't concentrate, you're not attentive. All right, there's also number 9, recurrent thoughts of death. You just feel like you want to die, or you want to kill yourself, or you want, just thinking about death and suicide and everything, or even killing others. Okay, so for that was about criteria A. So you have to have more than 5 of these symptoms within a 2-week duration for us to consider a major depressive episode. For criteria B, the symptoms cause clinically significant distress or impairment of social, occupation, or other important areas of functioning. Yeah, at home, job, at school, at church, whenever social gatherings. Yeah, there is marked impairment. All right. For criteria C, the episode is not attributable to the physiological effect of any substance or any medical condition. So it just happens where there is no any substance or medication involved here. All right. So if we meet the criteria A, B, and C, probably you have a major depressive episode. And for you to rule in out bipolar 1 disorder, you either have the mixed you either have like at least one manic episode. I think we've said, yeah, the 4 criteria should meet the 4 criteria, or this major or a mixed, that is mania or hypomania plus major depressive episode. Okay, so for bipolar 1, that's it. Yeah, then what are the differential diagnoses if in case you're suspecting someone in this bipolar 1? Major depressive disorder, all right, because of the major depressive episode. Other bipolars, we have talked about bipolar 2, cyclothymic, and all those. We are just going to look at the criteria. If it doesn't meet the criteria for bipolar 1, you consider the other types. All right. So we also have anxiety disorders. Maybe next time, if we have time, or if I remember, I tend to forget, maybe sometimes we'll do a video on anxiety disorders. All right. So substance or medication induced bipolar disorder, because you remembered in the criteria we were ruling out substance or any medical. So if it doesn't meet the criteria of bipolar 1, so we can think about substance related or medically induced bipolar. Okay, so if in children and all this, we have ADHD, that is attention deficit hyperactive disorder. And another differential is personality disorder, especially the borderline personality disorder. Okay, so for bipolar 2, we have, that was all about bipolar 1. I want to just rush on this because yeah, I don't want the video to be that long. Yeah, so for bipolar 2 disorders, for criteria A, the criteria have been met for at least one hypomanic episode. Yeah, we have already talked about hypomanic episode, so go and revisit that. All right. So, and at least one major depressive episode, that is criteria A to C, another major depressive episode. So for criteria B in bipolar 2, there has never been any manic episode. It has not met manic episode. Do you remember the criteria for manic episode? Yeah, revisit that. You can just go back in this same video. All right. So for criteria C, the occurrence of the hypomanic episode and MDD is not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified or unspecified schizophrenia spectrum and other psychotic disorder. I think I'll do another video just very soon about schizoaffective, schizophrenia, and all those. Yeah, schizophreniform and all those disorders. All right. So, and for criteria D, the symptoms of depression or the unpredictability caused by frequent alternation between periods of depression and hypomania causes clinically significant distress or impairment in social, occupation, or other areas of functionality. All right. Yeah, that's it. I won't dwell much into it. For differential diagnosis, include the other ones. Okay, for this differential diagnosis of a bipolar 2, we have MDD, we have cyclothymic disorder, schizophrenia spectrum and other psychotic disorder, panic disorder or other anxiety disorder, substance use disorder, ADHD, personality disorder, or other bipolar disorders, those ones that we had already mentioned. Okay, so for cyclothymic disorder, I'm rushing here because we already at, I think, 30 minutes, 29 minutes. Yeah. So for cyclothymic disorder, for criteria A, it says this for at least 2 years or 1 year in children and adolescents, there has been numerous episodes with hypomanic symptoms that do not meet criteria for a hypomanic episode, and numerous periods with depressive symptoms that do not meet criteria for a major depressive disorder. So in this period of 2 years, we have we have hypomanic episodes, but these hypomanic, they don't meet the criteria for hypomanic episode, right? And we also have depressive, but it doesn't meet the criteria for major depressive episode, and it will run on a period of 2 years, we have said, in adults, and in children and adolescents at least 1 year. For criteria B, during this 2-year period, all right, or 1 year in children and adolescents, the hypomanic and depressive period have been present for at least half the time, and the individual has not been without the symptoms for more than 2 months at a time. So, example, we have 2 years. This person should have at least these symptoms for 1 year, all right? That is half the duration of this time. Then this person should not be without symptoms for like 2 months. Like the person cannot live for 2 months without having symptoms, all right? So they should be present for at least half of this duration, and during this duration, during this period, at least have symptoms in 2-month duration, all right? For criteria C, criteria for the major depressive, manic, or hypomanic episode have never been met, all right? You can't meet the criteria for these other ones because it will just disqualify the diagnosis, all right? So for criteria D, the symptoms in criteria A are not better explained by schizoaffective disorder, schizophrenia, schizophreniform, delusional disorder, or other specified or unspecified schizophrenia spectrum and other psychotic disorder. Yeah, they are not explained by this other schizo what are these called, schizophreniform, or this what psychotic disorder. It's psychotic, all right? So for criteria E, the symptoms are not attributable to any physiologic effect of a drug or any medical condition. And the last criteria for cyclothymic disorder, the symptoms cause clinically significant distress or impairment in social, occupation, or other important areas of functioning. I'm not going to dwell so much on the specifiers and all that and comorbidities. We are just rushing on the diagnostic criteria. So that is for cyclothymic disorder. So what are the differential diagnoses of cyclothymic? One, we can have bipolar and related disorder due to another medical condition. We can also have depressive disorder due to another medical condition. We can have substance or medication induced bipolar disorder. We can have a substance or medication induced depressive disorder. We can have bipolar 1 disorder with rapid cycling, the bipolar 2 with rapid cycling, and borderline personality disorder. I'm not going to check on the comorbidities, all right? So for the third classification, and this is fourth, we have talked about bipolar 1, bipolar 2, cyclothymic, and now we are at substance or medication induced bipolar and related disorder. What is the diagnostic criteria? Remember, we are using DSM 5, okay? So for criteria A, there is a prominent and persistent disturbance in mood that predominates in the clinical picture and is characterized by elevated, expansive, or irritable mood with or without depressive mood, or markedly diminished interest or pleasure in all or almost all activity. Okay, so there is that persistent disturbance in mood, all right? And we have said it can either be characterized by the elevated, expansive, or irritable, or they can be or without a depressive mood, all right? For criteria B, there is evidence from the history, physical exam, or lab findings of both 1 and 2. So what is 1 and what is 2? For 1, the symptoms in criterion A, these symptoms that we've talked about, developed during or soon after the substance intoxication or withdrawal, or after exposure to medication. All right? So this, what is it called? These symptoms that we have mentioned in criteria A, they have to develop during, soon after, or exposure to that substance or medication. And two, the involved substance or medication is capable of producing the symptoms in criterion A. All right. So if it is, we are suspecting, example, cannabis or something. So cannabis in criteria B should be able, all right, to induce these symptoms, should be able to cause irritable mood, irritability, expansive, or depression. Yeah. So that is what for part B it talks about. And then for criteria C, the disturbance is not better explained by a bipolar or related disorder that is not what is it? What did I write? Substance. All right. Or medication induced. All right. It's not better explained by any bipolar related disorder. All right. And for criteria D, the disturbance does not occur exclusively during the course of a delirium. And for E, the disturbance causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. All right, these are the 5 criteria. One, a quick recap for criteria A. We have said during this period there's that persistent change either in elevated, expansive, irritable, and it can also have, it may or may not have a depressive mood. For criteria B, there's evidence from the history, clinical exams, or the lab findings that the symptoms in criteria A developed during intake, soon after, or exposure to this drug or medication. And for part B, part 2, it says that this drug or medication is capable enough to induce those symptoms. For criteria C, it's not better explained by any bipolar or related disorder. Criteria B, it does not occur exclusively during the course of a delirium. Criteria E, the disturbance causes clinically significant impairment or distress with the social functioning, occupational functioning of the person. All right, so yeah, we are almost done. For bipolar and related disorder due to another medical condition, yeah, that is part 5 under the classification. This is bipolar and related disorder due to another medical condition. For criteria A, there is a prominent and persistent period of abnormally elevated, expansive, just repeating the same thing, expansive or irritable mood, and abnormally increased activity of energy that predominates the clinical feature. All right, so there's that irritability, expansive, or it's just self-explanatory. I don't have to explain much. Okay, so for criteria B, there is evidence from the history, physical exams, and the lab findings that this disturbance is the direct pathophysiology or consequence of another medical condition. All right, so you have to have the evidence either from your history, from your physical exams, or from the lab findings. All right, for criteria C, the disturbance is not better explained by another medical condition. All right, and that is direct. Criteria D, the disturbance does not occur exclusively during a course of delirium. And for criteria E, the disturbance causes clinically significant distress or impairment on social, occupational, or other important area of functioning. All right, I want to go into the specifiers and all that. Okay. The last one, we have unspecified bipolar and related disorder. All right, so this category applies to presentation in which symptoms, characteristics of a bipolar and related disorder that can cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but do not meet the full criteria of any of those disorders in the bipolar and related diagnostic classes. Yeah, the person has these symptoms, example, or these features that we've talked about, but it doesn't meet bipolar 1, it doesn't meet criteria for bipolar 2, it doesn't meet for cyclothymic, it doesn't meet medical induced, it doesn't meet substance induced, or all that. It's just there, it doesn't meet any of these criteria. So we classify it as unspecified bipolar and related disorders. I hope we have been together. I've rushed through this episode, all right, because it's a bit long and I don't want to make very long videos that will be boring to you guys. All right, so kindly subscribe, support me as I continue to create such videos to educate you. Just quick recap, a 40 minutes video, and you've just covered all bipolar and related disorders. How amazing. Yeah, so kindly hit that subscribe button, share this video. Yeah, I want to know your thoughts, whatever I have missed to mention, whatever, I've been rushing, so maybe there's somewhere, maybe I've confused you guys or something like that. So kindly let me know in the comment section. So till next time.